Hello, Dr. Ashima. Can you share the agenda, the PDF, copy of the agenda in my WhatsApp group?
We are sharing it.
Please share right away, MD.
We'll share it again.
I thought I saw it, but I somehow missed it again.
See. Step conference yang ini. Ya, đúng ạ. Đấy. Participant ID bukan dong ini.
Good morning.
Good morning, everyone. I just got a word from MD that we might just have to wait for a little more, like maybe up to 10 minutes. So should we start right away with the introduction or? Am I audible? Hello?
Yes, ma'am, we can hear you.
I think we can start.
Okay, so MD will be joining in 10 minutes. So I think as per the agenda, maybe we can start with the introduction, especially with the participants also maybe can put the introduction in the chat box. So over to you, Dr. Sanjay.
Aarti,
Yeah, Aarti, could you please start?
Sure, sir. So, a very good morning to everyone. I, Aarti Gupta, Manager, Sambandh Health Foundation, welcome you all for the State Conference on School Health and Wellness Program. We have got more than 4,000 registrations for today's session, but due to limited capacity on Zoom, this conference is being live streamed on YouTube as well. So, to all the participants of today's conference, please ask your colleagues who are unable to join the Zoom session to kindly join on the YouTube live. We will share the YouTube live link with you in the chat box, and we will also personally WhatsApp it to you. So, for this today's very important session, we are joined by Sir Shri Ramkumar S. IAS. He is the Secretary, Health and Family Welfare Department, Government of Meghalaya. And as indicated by the Health Department, he will be joining us shortly. And we are also joined by Sri Swapnil Tembe, IAS, Director, School Education and Literacy Department, Government of Meghalaya. We have also been joined by our esteemed deputy commissioners from various districts of Meghalaya. I would like to mention Shri Abhilash Sir, Deputy Commissioner, East Jantia Hills. And from the health department, we have been joined by Dr. Novreen Marak, the state nodal officer for the school health and wellness program. Ma'am Flourish Lindo, he is the consultant for the school health and wellness program. From Sambandh Health Foundation, we have the trustee Sanjay Seth. We have also been joined by Dr. Ashima Sareen, Director, Sambandh Health Foundation. From the education department, we have the state coordinator, Ma'am Jenny Sindram. And with this, we would like to start this today's session with the introduction about the school health and wellness program. So I request Ma'am Novreen Marak to please initiate.
It's, Madam Flourish, would you like to just do the introduction or should we start?
No, I think Madam Novreen is traveling. I think she's back. She's back. Okay, let her speak.
So without any further delay, we would like to start the session with the about the school health and wellness program. So I request Ma'am Jennifer Sindram, State Coordinator, SIMAM SSA, to please tell
Aarti,
us what is school health and wellness program.
Hello, Aarti. I think Madam Novrina is back for the introduction.
So great, ma'am. We can start with Ma'am Novreen.
Okay, so since Madam Novrina, I think I lost her connection. On behalf of the health department, I take this opportunity to thank the respected mission director who will be joining with his approval for this webinar, and also our respected director school education, Sir Swapnil, who is willing to join us in this very important meeting. I also extend my welcome to all the participants from all the districts, and also the state officials, and especially the team at the field level who are actually spearheading this very important program. I thank the Samban Foundation for hosting this webinar, and I hope that with this webinar we will have a more understanding of this program, and more importantly, it will guide us on to our next step ahead. And with these few words, I welcome each and everyone, and I wish you the best for this 1 hour session. Thank you.
Thank you so much, Ma'am Novreen. So I request Ma'am Jennifer Sindram, I open the forum to Ma'am Jennifer Sindram to please share about the school health and wellness program.
Okay, a very good morning to all the esteemed dignitaries, especially Sir Sapil Timbe, who's been joining us, Sir Ram Kumar, who is going to join us shortly, the Secretary of Health Department, the National Health Mission Director. So I also would like to extend my welcome to all the participants, especially all the DCs of the respective districts. Welcome, sir, and all the participants in this who are included of the district school education officers, the district mission coordinators, the district community coordinators, the BRCs, the CRCs, the head teachers, the head teachers, principals, and all the teachers who are as the school health and wellness ambassador. Actually, this was in collaboration uh, with Madam Flourish and Dr. Novarina. We have been started this program since very dedicatedly by Madam Flourish for quite a long 3 to 4 years, from since 2020. So actually, the platform introduction should be provided from them also a little bit. But since you have given me this platform, so I really thank the Samban Health Foundation, the team under Mr. Sanjay Seth, Dr. Ashima, RT, and all the team members for giving me this platform. So let us why school health and wellness program? Why it is mandatory? What is the importance of it? As you will see that school health and wellness program is being initiated by the government of India, and it aimed at promoting the health and well-being of the students across the country. So this program is being running across the country in collaboration with the health department and the education department. So the program focuses on providing a holistic health education and services to adolescents, ensuring they receive the necessary support to thrive both physically and mentally. So as you know that the teenage pregnancy in Meghalaya is higher than the national average, which is around about 7.9% as per the NFSSHS, that is the National Family Health Survey report. It is and the national average is 6.8. So it is higher by 1.1%. So this is a need of the hour that we should address this issue and the well-being of the students. That's why the school health and wellness programs are being implemented all across the schools. Then when we see about the substance misuse, so the substance misuse, the drugs abuse is very highly prevalent in our state at this particular period of time. It is known as, our state is known as the devil triangle, as we all know, because now the prevalence of substance abuse, drugs abuse is very high in the state of Meghalaya. So when you see all these reports, it seems that we have to give more importance on health and wellness of the students, more awareness to the students so that they have the freedom of choice, whether they want to live longer, or whether they want to commit suicide. So this is what about the importance of health and wellness education in the school. My dear teachers, this important subjects is very mandatory, since you all know that teenage pregnancy, maternal death is very high in our state, drugs abuse is very high in our states. So for this reason, with various information, with various strategies, with various survey that been conducted by the National Family Health Survey, these issues arises in our states, which shows that the importance of health and wellness education in the school is mandatory. So the importance of a health program for the adolescents, because adolescence is a period of change, as we all know. It is a period of change where we transit from the childhood to the adulthood. So here there is a very, if we really triggered, if we really have more, what to say, more, we stress on more information, a correct information, not those information which has been, but that's true by the kids on their own. Because why? They will have their own mind, they will have their own thoughts towards it, so it might misdirect them. That's why the school health and wellness ambassadors here play a very important role to direct the child, to direct the students, so that, to direct the adolescent child not to fall into prey. So it's the duty of the teachers of the school health and wellness ambassadors to give this particular message to the student. Although we know the impact, we don't know what will happen, because we have just started for just 3 years. We haven't seen these kids growing. So let the impact be 10 years to 20 years down the line, when they have full maturity level. So the important is that the holistic development, the school health and wellness program focuses on the overall development of the adolescent, covering the physical, the mental, and the emotional health of the students. Then the point number two is psychological support, providing necessary psychological support to help adolescents cope with various challenges and stresses. Then we go about the third points. I'm going to touch on resources and services. Then ensuring adolescents have access to health resources and services, including counseling, healthcare, and educational materials, which the state of Meghalaya, through the education department and through the health department, we are thriving about giving proper information towards our adolescents group through school health and wellness program. Then, point number four, I want to touch on the awareness and education, raising awareness about critical health issues and educating adolescents on how to make informed choices about the health and well-being. As I reiterate the words of informed choices means they will choose when they have grown, because if you give the correct information, that's why the teachers are the guiding stars. They have to guide the students, they are the role models of the students, in which they will impart all the health and well-being towards the students. So the school health and wellness program plays a very important role in the students in the adolescent stages. So we have about the 11 modules under this school health and wellness programs. And these 11 modules will consist of emotional well-being, interpersonal relationship, responsible citizens, gender equality, reproductive health, HIV prevention, safety and security against violence, and promoting of safe use of the internet. So these 11 modules, they are really being worked on, not just like that, but by by the Ministry of Human Resource Development, Ministry of Education, then the Ministry of Health and Family Welfare, along with the National Council of Education Research, in which they have developed the curriculum framework and a training module for all the nodal teachers on these 11 themes to provide to the students at the level of the school when they have provided these training towards the school students. So the school health and wellness program it's being designed that there should be two health and wellness ambassadors. That means the school teachers, one male and one female. If not, they are both male, Sometimes they are both female. It depends upon the capacity of the schools and the intake of the schools. So, and then these schools, they have to conduct 24 health period or health session for the whole year. So one period they should dedicate it in a week for this particular school and health and wellness program on these 11 modules. So it might be there is no synchronize that you should take first the gender topic or you should take first the reproductive topic. It depends upon the intelligence of the teachers to implement these. So as you know, that I will come to an end of this because we have so many people to talk about the importance. But even sir is going to join us with this importance on the school health and wellness program. Just I was touching on just a little bit of this, what is the importance and why it is very necessary to educate, to provide the students the school health and wellness program, why it is mandatory, why teachers have to work. Yes, I know teachers, you are very burdened with many works, but teachers, remember that your work will pay to you in 10 years, 15 years down the line. When you retire in the future, you'll see that these students are my students, and especially when they be someone in the future, you'll be very proud of it. I once upon a time, I was also a teacher. Many of my students also have come up with flying colors. Some are doctors, some are engineers, some are teachers, so in some are administrators. So in this manner, I could feel that really, if you teach the students and if you see them how it became in the future, you'll be very happy and you'll be very satisfied in your retiring life. With these few words, I would like to conclude my little bit of introduction about SHWP. This is a very important scheme again. It's a very important program which really it is the need of the hour to discuss with all the adults and youths in our states so that we can prevent teenage pregnancy, we can prevent substance abuse, we can prevent even suicide cases, because many of the cases are suicide cases also is due to overuse dosage of drugs and so many other mental issues, emotionals, psychological during teenage. So many things can be caused. So this is the platform that we should address the students properly on the school health and wellness program. So I would like to really leave the platform with this concluding remark. Let us start small, and in the future we will see, yes, we have done something for the students of our state. With this word, thank you. Thank you. I'm okay.
Thank you, Jenny. My name is Sanjay Seth. I'm a trustee of Sambandh Health Foundation. And it's my very great pleasure today to welcome Mr. Ramkumar, Secretary Health, Mr. Swapnil Tembe, Additional Secretary Education, and many DCs are here, Mr. Jagdish Chelani, Mr. Abhilash Banwala. So many DCs are here, many senior education department and health department people are here, and we have more than 1,000 people on the Zoom right now. Plus, we have a few hundred who have joined through YouTube because we have a limited capacity over here. So more than 300 have joined on through YouTube. So we welcome all of you. And the whole purpose of today's conference is to basically talk about this very important issue which faces our society. When we see, headlines like this, we all know that there are social problems which are actually impacting our young people. And for them, if you talk of education, for a young adolescent who is let's say pregnant, where is the question of having an education? So for us, their mental, physical health is equally important as what we teach them. And as we can see, there are many headlines which are very disturbing. And for instance, Meghalaya has the highest child stunting rate of 46% compared to the national average of 35%. Drugs is a big problem in our society. We look at the wrong understanding, false beliefs young people have about HIV transmission very high. If you also look at contraception use, very low compared to what is nationally being used. And if after all this, the one question comes, why can't all these things be taught in school? Children, adolescents should know about teenage pregnancy, should know about sexual violence, should know about gender equality. These are vital topics of which impact their lives. They can derail their future. So we need to teach this in school, and that is exactly what is being done with this program, the School Health and Wellness Program. Madam Jennifer Sinram has already told you that we need to tell our adolescents age appropriate learning, and 11 topics modules have been selected. 2 teachers in every school are being trained, and 2 students also are being trained to help in this program. So the idea is that with this program, it will make a huge change in the health, mental and physical health of our adolescents and their future. And what is needed is a health period. The Director Education has already given a notification that 1 period a week be designated as a health period where this has to be taught. And we have to ensure that there are 24 periods in each academic year teaching those 11 modules. Okay, what does someone do? We track every period. We have an app, and after you hold that period, you report it on the app. We monitor, which school is done or not done. We follow up and we support. If you are having any problems, we try and resolve those problems. We keep reminding you that you have to have this session, and we are providing online training. Because without training, your teachers cannot teach these subjects. So there is a very good online training program going on, and I will share the data with you. Many people, many HWAs, many teachers are undergoing that training. So we are also sending you regularly these kind of messages, which is basically to remind you how important this one health period is and why you need to teach it. This is for us adults, some of this stuff is all well known, but for adolescents, it is important that we talk to them about it. So far, out of the 3,000 odd schools which are supposed to be conducting this program, only about 81% schools have appointed HWAs, that is, have appointed 2 teachers whom we are calling health and wellness ambassadors or HWAs. And the other schools have yet to appoint their 2 teachers for this program. Okay. So far, about 72% of the schools have done an activity, have held sessions, and have reported. But as compared to the number of sessions which should have been done, I mean, for instance, up to April, 19 sessions should have been done. So far, only 30% of the targeted number of sessions have been done. So obviously, this is an area which we need to push up. Okay. Now, the training which we are holding is we are teaching everybody online. There are 12 webinars which all the health and wellness ambassadors have to undergo. One webinar is an introduction on how to use the app. And then there are 11 modules, 1 webinar on each. Now, this training is being conducted online at very convenient slots. For instance, on Mondays, we will do module 1. We hold 3 webinars during the day. You can attend at whatever time is convenient to you. And if you pass the test for that module, you get an e-certificate. If you complete all the 11 modules and get e-certificates for all 11 modules, you will get a physical certificate and you will be called an adolescent expert, a certified health and wellness ambassador. So already hundreds of teachers, health and wellness ambassadors have completed the 11 modules and have been getting this certificate. Those certificates have already been shipped out. So what are the challenges or gaps right now? The gaps are that we still 20% of the schools have yet to appoint their health and wellness ambassadors. It's very important that they do so. It is also very important that that the 28 odd % of schools which have not been activated, when we say activated, it means they have not held a health period at all. All right, they should start holding this health period. And of course, we need to increase the number of health periods. So far, of the targeted sessions, we've done only 30%. We must take this up to 80 to 90%. Now, we know that some of you don't have the resource materials. We are sending you the digital resource material has been supplied to all schools, to all the teachers. Physical, we are also arranging, and you will get, if you haven't got it, you will get that too. But meanwhile, you have the digital resource materials all available, so there should be no problem in conducting the sessions. So with that, I want to thank you once again for attending today's session. We've already have more than 400 people on YouTube, more than 1,000 people over here. So this is a lot of people here. We thank all of you for joining this, and I would now like to invite Mr. Swapnil Tembe to please share his thoughts. He has been leading this program. With his leadership, this program has really been taking off. And I invite Mr. Tembe to please share his thoughts about this program. Thank you.
Thank you to everyone who's present here, and thank you for inviting me for being part of this panel. A brief introduction on this program has already been given, so I'm not going into that. I just have some brief comments to make. It was shown in the presentation given that around I think 2,600 schools are being targeted, and out of which 80% or something has been achieved. But still, I mean, as we speak, we have like nearly 15,000 schools in our small state of Meghalaya. So we have a long way to go, basically. The point here is. And especially the ones, I'm not sure if you have done the mapping of the schools which are being covered. Are they mostly in urban areas or semi-urban areas? And are we touching the, where it's actually very important to reach out? So are we touching those schools? So that's something which needs to be seen. We have in our system nearly 54,000 teachers in the state, and training them is a challenge. We have only 7 diets. The National Education Policy says that 50 hours of TPD should be there every year. That also includes things like these. But our diets do not have the capacity, and they are hardly doing 2-3 hours per teacher. So that's a very poor average. So we need to, and this being a very important topic, and without the involvement of teachers, nothing can be achieved. So we need to reach more teachers. And I think this form of webinars so Nishtha, if you are aware that we have a wonderful platform which Government of India, Ministry of Education has made for all kind of training and certifications, etc. So that platform can also be used, or these kind of webinars can be used to cover all teachers, because physically covering all of them is impossible. And this is the way we have decided to cover them in other trainings as well. So maybe you can also explore this to cover more and more teachers. That's very important. And once we train the teachers, then I think it will go on its own autopilot mode. Then another very important thing is that with respect to schools, there are 2 features. Like one is the midday meal, which is now called the PM portion. So that forms a very important part of the health aspect. And so what was happening was there was no kind of a check on whether the meals served are nutritious or not and all. So now we are collaborating with our SFTL, which is the State Food Technology Laboratory, for food testing, sorry, laboratory. And they will be taking samples and they'll be suggesting that, how we improve our food menu, etc., etc. So that is one step towards improving the meals in these schools. Over 6 lakh students take these PM Poshan meals every day in Meghalaya. So that's a very important thing we need to monitor closely, and this may have a very good impact on the health. There are some cases of MAM, SAM. So, if that is there, so we can address through nutritious meals also. One step which we have taken in this direction is the establishment of school nutrition gardens. On 28th of April, we had only 9%, around 1,000 school nutrition gardens. 29th, we celebrated School Nutrition Garden Day. And we asked all the schools which have not started to start. So on that one day, more than 3,000 schools started school nutrition garden. So we have now jumped from 9% to almost 50%, 49 point something as of yesterday. So our target is to have 100% kitchen. I mean, now it's called school nutrition garden in all the schools which are serving meals under this PM Poshan. So that will achieve definitely by the end of this year through various means. So this again will have a great impact on the health aspect. And the other is sports. We have several things from the Directorate of Sports. We have inter-school sports. We have then district level athletics meet, school athletics. There's Subruto Cup and all. But they are only selective schools. When we see the data, only every year the same schools are participating, and more or less it's kind of a fixed thing. So we want this to spread across, especially in rural schools, because it is obviously seen, and it's very agreed fact that if they spend at least 30 minutes, 60 minutes in any kind of sport, so it'll again have a great impact on the health, and it will bring a positive attitude as well. So all these things have to be ensured, and which will be ensured from our side. The last point I want to mention is that bringing in this, the whole thing in the curriculum itself. So when we induct teachers, there is, as of now, there is no proper induction training being given, and they just join the schooling system and they start teaching. And even so most of the trainings are in-service trainings for the teachers. So there's no induction or orientation. So we are going to start with that. And of course, one important feature of that training, we are already talking with DERT, and it's being structured, will be the school health and wellness program. So before they go to the school, they will be told everything about this. And in fact, NEP now says that like ITEP will be there, the integrated, like the 4-year B.Ed course, BA B.Ed. So in that also, why not? I mean, we should have this. So maybe we can suggest this to send a letter to NCTE and NCERT regarding including this into the like B.Ed courses itself, so that before even they come to the system, they know about all these very important things. And yeah, one last point I want to mention is that the Bala, I mean, the building as learning aid. So this is a very interesting concept where through murals, designs, and specific structural designs or innovations, you teach something to children. So this we are promoting under Samagra, and we have done under like I think around 2,000 schools, focusing on learning. But we will now also, taking a clue from this program, we will also include health in it and try to introduce some Bala features in the school buildings in a way that they remind children what to do, what are the right things to do, what are the right habits for good health, etc., etc. So these are the few points which I wanted to mention, and hopefully in the coming times we will keep on improving, and we'll try to touch all the schools. So whatever your numbers are, we'll try to saturate in the coming years, and whatever support is needed from education, we'll be happy to help. Thank you.
Thank you so much, Mr. Tembe. And now I call upon Mr. Ram Kumar, who has Secretary Health, who has been the leader of and has brought in so many innovative ways of taking this agenda forward. And after him, there are 4 DCs here on this in this meeting. I'd like to invite them also to say a few words. But now, Mr. Ram Kumar, we look forward to hearing from you, sir.
Thank you, Sanjay ji. Good morning, everyone. To all the deputy commissioners who have joined, I'm very happy that quite a few of you have joined. Mr. Abhilash, Ms. Hema, Jagdish, East Kasil, CP sir is also here, and Abhilash and others who have joined, along with Director SSA, Mr. Swapnil, Kong Jenny, and DPMs of NHM, various cluster resource coordinators, teachers. Very, very happy to see so many of stakeholders who have joined this very important webinar. In fact, to tell the importance of this, etc., I think already quite a few of them has been tell. I'll just tell you a simple case. What happened last week, 2 weeks back? In fact, we had reviewed in Mokarwat, one college girl, going girl, I think must be 11th, 12th, and just enter college, 18 years old. She was pregnant and did not know what to do about it. And she did not tell anyone. In fact, the most important thing is no one able to identify that she was pregnant, not even the family member. No one is able to. At the 8th month, she got into complications. She was half a kilometer away from Mokarwat Civil Hospital, half a kilometer away, walkable distance. She did not go. She went to, because it is all taboo and etc. They went to a TBA, got complicated, and she died. Now, this is not only one case. Just before this review, we are reviewing other cases in East Khasi Hills. We have a very in-depth review system. We review these cases. When these cases happening, I'm thinking that, where as a collective society we failed in terms of, educating or saving this particular girl. She might have wanted to become a great scientist or, excellent musician or something, but we lost her. Now, how are we going to actually kind of stop these from happening? This is not something that should be happening in this business. And this is I can quote 10, 15 cases like this off the hand who are 16, 17, 18, 15 years old. Just yesterday, we reviewed a case for a 23-year-old, which she has having a sixth child. If she is 23 years old, you are having sixth child. When did you have your first child is a question. So now, when we think about it again and again, we talk about awareness. So where is this awareness going to come from? I am what I am today because of all the teachers, great teachers I have had in my school as well as in college. And most of the ethics, what I learned it from them. I did not learn from any, straight away giving from any book or any scriptures or anything. I learned it from them. It was them who, in fact, one of the teachers were the ones who motivated me to get into public service, why public service was important, what was important. So it is them, it is there, it is in fact in school where most of our ethics and values are set. And unless there is an opportunity for us to talk about it. And that's why teachers become so important, integral part. In fact, I would say the spine for any modern society. Without them, we will not be able to build anything, solid in a society. Whatever we build, we might have suddenly great resources in terms of, mining or oil or whatever we might have. This will give money, but it will not give the overall state capacity or human resource. Human resource is the only, long-term resource which we have. So for that is why the school health and wellness program becomes very important. This is cross-sectoral, and where because in health we don't do that unless you know language. You can type on something and you ask something, you will not know how to learn something. So in schools, when we need to talk about this very, very seriously, and we need to talk about it very openly and very frankly, that's something is so very important. In fact, in our school, when we learned, that was a time when HIV was becoming a pandemic across the globe. We were having a session on HIV, and they were told me what was the HIV, how it spreads, and etc. From that day, it was very seriously informed to us what was the seriousness about it, and that rate, and both HIV can spread through unprotected sex as well as through cross needle or etc. using. So from then onwards, it becomes a very important thing. At a very young age, it's a very impressionable age in overall this thing. That impressionable age is very important in terms of where this kind of learnings happen, as well as how it stays for longer time. So it's so important to do that. So that is why we have kind of formulated this system where one period in 1 hour in one school, they talk about health as a topic. health is not only an individual's responsibility or their own responsibility, it's a collective responsibility, everyone's responsibility. In fact, if someone is not, if taking drugs or not these things, someone has to advise them. Please see to that, are you okay with this? Are you right? Or this is an informed choice or not? Are you being compelled into it? Are you know what is the things to be done? Everyone has to talk about it. Unless we talk about it collectively, we'll not be able to solve this problem. Whatever problems we have solved as a society together, be it in Meghalaya, be it, I would say, this is because of continuous talking. You can take it from the whole, freedom struggle or constitution or election or anything. These are all something we have everyone discussed regularly. Only then we are able to arrive that. Similarly for health also. So I really would like to appreciate the involvement of education department in very proactively. Whenever we have asked for this, they have been very extremely proactive in terms of taking this across to teachers. So the hundreds of teachers who have joined in this meeting, I can't overemphasize your role as makers of society. That is both, it goes both ways. If you do something, there is a positive impact. If you don't do something, there is a negative impact. That is a very important link between health and education. There is both act of omission and act of commission. Both of it has an impact. In many other fields, if you don't do something, there will not be any impact. But if you don't do something, there can be a negative impact. That's something. If that girl in Makarot, someone had talked to her about, spoke to her about anything. So why don't we have that kind of conversation? Why don't we encourage them? And many of them get into this vicious cycle of early child, no other livelihood opportunities, poverty, anemia, child malnutrition. Again, that same cycle comes. So it's a very, very tight cycle in Meghalaya. We have one of the highest fertility rates in the country, highest stunting. We have very high non-communicable diseases among children. Many of you may not know this. The rate of diabetes among 15 to 19-year-old people in entire India, one of the highest is in Meghalaya. We know about wasting stunting, but diabetes and hypertension at a young age being very high is in Meghalaya. That leads to a lot of kidney infections and then later complications and people dying. It's very serious. And that's why we want to talk about health, about nutritional food, about what are the preventable aspects and why health is a collective subject. This is why we also had village health councils in all the villages. We have given an IEC book to each of them. We have community trainers and we also are able to talk to them. Many of the villages have picked it up in South Garo Hills, in many districts in Southwest Kasi Hills, East Kasi Hills, Riboy. Many active village health councils are working, but along with the school health and wellness ambassadors who are part of the community, when they all work collectively, the results can be transformational. So that is something I want to leave. My request to all of them is to the teachers and etc. is to ensure that the deputy commissioners also who are there. One small question: whenever you go for upper primary schools, we are charting mostly for upper primary and fifth class, and that's where our target is. Just ask this question: did you have a health and wellness period? What did you talk about there? That's it. And do they know what to talk and how we etc. So Samman Foundation has been very helpful in terms of rolling it out in a mass scale, because it's not easy. As Mr. Swapnil mentioned, we have a large number of schools here and it is not very easy to touch point base with everyone. But as leaders at the district level, if all of us ask the same question, then the importance would be realized. So we have done excellent with the Tobacco Free Education Institution program, where we got even a World WHO recognition and all for how aggressively we have gone in Tobacco Free Education Institutions program. And many teachers have extraordinarily contributed because they see the importance of it and they have done great contributions. Similarly, we have to expand that into a school health and wellness subject also. And the previous DGP and the president, they've all been extremely supportive in this, from tobacco to de-addiction to, and how we want to talk about all the teenage pregnancies and drugs and etc. So these things we need to continue speak. That's why there's a system. Today is also to just remind everyone that there is a system. This is the system, and we would like to encourage the system to function very well so that continuous messaging to children happens and they are not in any confusion that this is important and this is everyone's responsibility, and health in that day at that age is absolutely it's in their choice and they can take the best possible choices and how they want to go ahead. So I will stop there. Maybe with your permission, Mr. Sanjayji, can we ask maybe Sibi sir alone to say a few words if he is there, if there is time for that. Sir, are you there?
Yeah.
Maybe DC is because he left. They have another meeting going on, so maybe he's gone there. But maybe if any couple of deputy commissioners would like to say of anything, we'll be more than happy to listen. Maybe Jagdish or Abhilash, Emma, anyone.
Good morning, sir. Good morning, everyone.
Any deputy commissioners would like to say anything? Any few words?
So am I
Hi,
audible?
Jagdish. Morning. Please go ahead.
Yes. Sir, this is wonderful. So I
Yes.
believe listening to both the team from Sambandh and Swapnil sir and you, sir, I believe this is the way forward for us as well. And sir, lately I was thinking that we can actually hold a regional conference for all the important principals of different schools, including the foundation members and our department officials, so that we can translate this vision regionally from one place to another. At the district level, sir, I'll definitely be initiating that from our side. So that conversation keeps happening over a period of time. So that will be some part of that, sir, where we will where I'll seek some kind of guidance from both the organization and you, sir, as well as from Swapnil, sir. Rest, sir, I'll hand it over to Abhilash and Hema if they would like to add on some matter.
Thank you, Jagdish. It's a very good idea. We'll take up on that. Anything from Abhilash and Hema?
Good morning, sir.
Hi, Hema, please.
May I speak, sir? Yes. Sir, yes, sir, as pointed out by DC sir from West Garo Hills. So here also, I feel, sir, we'll take up some cluster or block level training, sir, if possible. Because in election, we do it, sir. So we have this series of trainings and meetings, maybe over weekend or Friday, Saturday. So we can also do some sort of district level a training or awareness generation program for all different headmasters and even assistant teachers of all different schools, sir, batch wise. At district level. And secondly, sir, what we do if we are doing district level health review, we always include ICDS and MS Serales, and we don't usually call education departments, sir. So I mean, from now onwards in district level health review, we'll try to include education also, sir. At least the district and block functionaries from education department will try to include our in our district level health reviews, sir. And thirdly, one thing I've noticed is that the different communities in the district or in the state, so they have different food habits. The eating styles of different communities is little different. So that also, I mean, if teachers come up with their own, I mean, set of rules and all in their own schools, that would be better, sir. So we'll have to give this handholding to teachers to understand the particular food habits of that particular area or that particular village and that particular community, so that these specific gaps in nutrition also can be addressed at the community and village level, sir. Thank you so much.
Thank you, Hema. Very important points. That's something I also feel missing. We are not taking up education along with in terms of these reviews. It should be very important. If you start at the district level, the program also will be there. Our nodal officer, Dr. Navrina, is here, as well as Flourish, our consultant also. Maybe quickly, Dr. Navrina, would you like to add a few points? I hope you could hear. Dr. Navrina?
Sir,
Yes.
good morning, sir. Dr. Navrina is not able to join, sir, because she's traveling for the quality assurance, and ministry team, sir, is there for the T3 campaign as well.
Okay. It's okay. Fine. So that's from, I think, anyone else from here who have the permission to speak? I think those have gone as speakers. So would anyone like to add any other points from education department also? Great. So over to you, Sanjay ji, if that's the few points we wanted to mention. The idea is that, we understand the importance of it. We just can't overemphasize it. And we want to keep it as much as possible, reach every school, and this conversation happens. That's the whole part of the idea of school health and wellness program, along with education. Whenever this, I think once in 2-3 months we should have this kind of webinars, and even district wise also. If you can involve the deputy commissioners and we can talk to them to organize it, it will be even much more impactful also. So over to you.
Yes, sir. We'll take that up. And thank you to you and Mr. Tembe and all the DCs who have joined together. It shows how committed the governance is in for the health of the people. And I'd just like to share with all of you, because we have been talking to a lot of other states, that Meghalaya is ahead of almost any state that we know of in this program. Which is good to know, but I think we still have a long way to go. And I think with your, with the leadership which is being shown in this webinar, and with the support of the 1,500 plus people who have joined today, I think we can really make a dramatic change in the health parameters which Meghalaya has. And in a couple of years or few years' time, we will all notice that it will show up in the numbers. And I think all of you will be very proud that all of us will be very proud that we have brought that change about. So thank you to everybody. And with your permission, sir, we'll close the webinar now.
Thank you. Thank you, Mr. Singh. Thank you, Lord. Thank you, everyone. All the best.
Thank you, all of you.
So thank you, everybody. We are shutting the webinar down. If there are more than 500 plus people on YouTube also. We are thanking all of you also for joining. And please, we'll be sending you the feedback forms. Please do fill that in and you will get your certificate for this important conference. Please fill in that feedback form so that we know who you are and we can send you the certificate. So thank you very much. If there are any other housekeeping calls, Aarti, please do share them and then we can close this webinar. So back over to you, Aarti.
So thank you so much, sir. So thank you so much to all our principals, headmasters, our health department officials and education department officials for joining today's session. And as sir has already mentioned that we have been joined by more than 500 principals, teachers, health and wellness ambassadors who have joined us today on the YouTube. And we have been joined by more than 1,000 participants here on Zoom. So for the certificate of today's state conference, on the YouTube, a link is already provided there. Please kindly fill your details there. Give your valuable feedback so that we can share your e-certificate with you on your registered email ID. And one thing, we have received a lot of questions regarding the physical certificates for the online training. So the first batch of the physical certificates, it includes around 140 certificates of 140 HWAs. It has already been shipped, and all the HWAs, you will receive your certificates shortly, most probably by next week. So on this note, I would like to close the session. Thank you so much for joining.
Aarti, you can end this.
Ma'am, the